So the other day on Instagram, I ended up making a statement, and I didn't catch a lot of grief for it or anything like that, but a couple of people did ask. So I figured I might as well make a video explaining my beliefs on mental illnesses, and essentially why I don't believe that many of the modern day ones exist. Now, this isn't my usual content, and you don't gotta worry, I'm not gonna all of a sudden shift. I'm still doing martial arts content, but I figured that this would be a good video to talk about, because martial arts did actually really help me out when it came to my mental health. In addition to this, I also have to say that I have absolutely positively no qualifications to be able to diagnose or treat mental illness, so keep that one in mind. Now, while I might not have any qualifications that allow me to really talk about it as an authoritative figure, what I do have is years of experience as a patient of the psychiatric field. And after seeing what happened with me, as well as a bunch of other people, I've tried to make sense of it all, and these are the conclusions that I've essentially been able to draw. Now, I want to say right out the gate that I do believe in mental illnesses. They do exist. Schizophrenia, for instance, autism, and you could even say autism is treated a little bit weird. I definitely don't think that it's as broad as the psychiatric field will try and pass it off as. But mental illness does exist, bottom line. Now, that being said, I'm not 100% sure if depression, bipolar disorder, if ADD, ADHD all exist. The reason I say this is because in most, and really if not, all the people that I have ever met, including myself, I have met myself, believe it or not, who have been diagnosed with any form of mental disorder, really, it's not necessarily that they had something wrong with them on a chemical or biological level. They were just really not very well-adjusted human beings. Now, I really don't mean to disparage anyone. I don't want to talk down on anyone. And as I said, I am included in this. But if you pay attention to these people, you'll notice that the people with certain disorders and illnesses, or whatever you want to call it, tend to end up having the same negative traits. You tend to see a bit of a pattern in the patients. Depression, for instance. When it comes to depression, what you'll notice is that a lot of people who have been diagnosed with it, and especially the ones that are on medication for it, they ended up having something bad happen to them. Whether it was one big thing, whether it was a bunch of medium things, whether it was even more small things, there was something that occurred to them that ended up breaking them. And when they were broken, they ended up dealing with it in a way that was not very healthy. And I understand, because if something that bad happened to me, I know that I would be a nervous wreck too. However, what tends to end up happening with these people is they are unable to cope with whatever it is that ended up happening to them. So they end up laying in bed. They end up not keeping up with their hobbies. They end up not going to work. And because of this, their life slowly collapses around them, while all they're focused on is how bad they feel because of that thing that ended up happening. Even if they don't realize that that's why they feel bad, is because they're choosing to continue to feel bad about whatever it was. Even if that's not the thing that's at the front of their mind, even if the trauma is not at the front of their mind, they're still continuing to feel that trauma in a covert manner. In addition to this, I've noticed that a lot of children who end up pouting to get their way when they're kids grow up to be depressed adults. And the reason I think this occurs is because these kids are learning that pouting is how they get what they want. And as they get older, because you know what, it's fine when you're 7, 8, 9, maybe even 10 years old. You pout, you get what you want. People might not like it a lot, but they're willing to let you get away with it. When you're 19, 20, 21 years old, nobody's going to give you what you want because you cried and you ran and you sat in the corner, or you refused to get out of bed in the morning. In fact, people are just going to hate you, and they're going to start taking things away from you, which is only going to add to it, by the way. But essentially what ends up happening is these kids who were pouting to get what they want when they were kids don't end up getting what they want when they're adults. And because of this, all they're left with is the negative feelings, is the negative way of coping with not having the stuff that they need. And of course, this learned behavior ends up becoming an ingrained trait that is seared into the mind of the person, that if they tried as hard as they could to unlearn, they would be a lot better off. They would feel a lot better and they would function a lot better. But instead of trying to get people to do this, we just hand them pills and tell them that they're depressed and that it's okay if they don't show up to work. Now, there's plenty of other reasons that could potentially explain why somebody ends up having a mental illness that do not boil down to them having a chemical imbalance in their brain. Really, what it tends to be, from what I've seen, is learned traits. That's what it boils down to. And you can see different learned traits that tend to lead to different diagnoses for different mental disorders. Bipolar disorder, for instance. What you tend to see in people with bipolar disorder is very, very poor emotional control. Not because they cannot control it, but because they never learned that mastery over themselves, in which they are not going to be angered by external factors. ADD and ADHD were the big ones for my generation, as well as the generation before mine, from what I understand. And the fact is, if you don't end up instilling discipline into a child, but not just instilling discipline, also raising the child right, nurturing them, giving them what they need out of not just a parent, but also an environment, they're going to end up acting out. And instead of recognizing this and trying to get people to make a change in how they treat kids, we just give these kids medical grade methamphetamine. When it comes down to it as well, it's not just that there's a bunch of weird coincidences. It's that the psych field seems to be a little bit broken and maybe even just a little bit corrupt. So the thing you really need to remember is that psychiatrists are not your friends. You are nothing but a meal ticket to them. This is a professional relationship, and in some cases it can even be parasitic to a degree. And this isn't really 100% their fault either, because at the end of the day, they have tons and tons of patients. They only get to see you for an hour every once in a while, maybe an hour once a week, maybe an hour every 2 weeks, maybe 1 hour per month. They don't know you well enough to really become invested. In addition to that, as I said, they have to try and be as invested as they can in a bunch of other people while also trying to help you out. In addition to this, in my experience anyway, psychiatrists are basically just pill jockeys. That's really all that they have the ability to do, at least from what I've seen. I've never seen a psychiatrist who has access to any kind of medical equipment that would allow them to have some kind of physical, concrete evidence of you having some sort of issue with your brain. This obviously presents an issue, because if there's no concrete way to tell if there's something wrong with someone, the next best thing is going to be having a checklist of very vague and broad behaviors that could mean anything, that anyone could have, that they end up using to compare to what you ended up telling them in the session. And if it lines up just a little bit too close, you're going to end up being prescribed pills and told that you're mentally ill. The last thing I'll say is that there's great potential for corruption in the psych field. And the reason for this is because the more screwed up you are, the more you're going to have to go back to them. And the more you go back to them, the more they get paid. They don't get paid as much money if someone is cured or if there was never anything wrong with them in the first place. And because of this, you'll see a lot of psychiatrists who, they're a little bit quick to try and diagnose you with certain things that you don't have in order to try and convince you to come back to them for some kind of treatment that you don't need. So that's all that I have to say this time around. Thank you for watching. I just want to reiterate as well that I do believe mental illness is a real thing. It's just that I'm not 110% sure I really believe that the modern day mental illnesses that you see a lot of people having are really a real thing. I'm not sure. I'm not saying yes, I'm not saying no. I'm just saying I'm not sure. But anyway, if you like this video, feel free to leave a like. Also subscribe if you want to see more. It will be martial arts content, of course. Like I said, this is not my usual content. Other than that, thank you for watching, and good luck out there.